Everybody, Chapter 8, Herbal Therapies. This chapter builds off of nutrition and drug interactions in some ways because when you talk about herbal therapy, by definition, it encompasses the whole plant, which then means it also would include food. So it's only when the plant or its constituent of the plant is identified as the primary reason for its effect on the treatment of the disease or the symptoms that then it's referred to as an herbal medicine. So herbs have long been considered one of the safest medicines to take, but just like foods, they can be classified as having mild or strong or toxic effects on the body. These are our objectives through the chapter. Overview of what we will visit about. So it starts the chapter with some definitions. So an herb is any plant or part of the plant that has therapeutic value. Herbal medicine is the art and science of using herbs for promoting health and preventing and treating illness. Pharmacognosy is the branch of pharmacology that uses the chemicals from plants, molds, fungi, insects, and marine animals for their medicinal value, which is interesting, right? So the leading therapy among complementary and alternative medicine in the U.S. is herbal medicine, and it's referred to as CAM, complementary alternative medicine. Herbs classified as food by the Food and Drug Administration. So the FDA classifies herbs as foods. There's still a potential always for the drug and herbal interaction. And oftentimes, what's important to remember, as we've learned before, is that patients often will not divulge their use of complementary and alternative medicine because they feel they're going to be judged by their healthcare team. So here's the slide that has the different definitions. Phytomedicine is the practice of using the plants or plant to achieve a therapeutic cure. When we call it Western medicine, what we're referring to is therapeutic properties and chemical constituents of the plants that we use as a quote-unquote medicine or a treatment. Traditional Chinese medicine is of importance because this is a lot of what we consider to be Eastern medicine. The plant's cycle of growth or the characteristics, the underlying condition of the individual, and the constitution of the individual are part of Chinese medicine. I do want to bring up in here when we're talking about Western medicine is that this is where the idea of naturopathic doctors come in. So they base their practice on the scientific examination of the plant. Western herbal medicine is different than Western pharmacology because although the plant is categorized by its effects and chemical compounds, the whole plant is used versus an isolate of the plant. The example that they give is ginger root, which contains sesquiterpenes that have significant antirhinoviral activity and are used to combat colds. So they use the whole part of it. I do like the way the book says that distinguishing the distinguishing feature between Western and Chinese medicine is the paradigm through which they view the humans. So traditional Chinese medicine, instead of looking on science to identify the source of disease or the source of health, traditional Chinese medicine looks to nature from the Taoist perspective. The book gives us a prescribing pearl that says, although this text does not cover traditional Chinese medicine or Ayurvedic diagnostic criteria in detail, or use the differential diagnosis to explain the disorders mentioned, the purpose of including some of these principles is to demonstrate how diverse diagnosis is and how it applies to the choice of herbal medicine prescribed. So just some general concepts of traditional Chinese medicine. Health is sustained by having a free flow of energy. This is where we hear things of like balance, both your yin and your yang. The herbs are classified by their energies, their quality, their season, their tastes, their direction, and their actions on the body. They value the power of food and healing. Part of traditional Chinese medicine is where we also get the aspects of acupuncture, Tai Chi, or energy movements, massage, and then balance concepts. I pronounce this Ayurvedic medicine, is life to study. So the herbs are delivered in massage oils or in food and aromatherapy, or you can take them orally. The herbal therapy is interchangeable with food and spices that are viewed as a sequence. I do not know a lot about this. It's not something that I encounter a lot in practice either, but I do think it's great to talk about it and learn about it so that you are more well-rounded for what your patients might bring to you. So it's the tridosha system. So 3 doshas exist: Vata, Pitta, and Kapha. And as you can read that here. The treatment is based on balancing the specific constitutional type for a patient, since each dosha is aggravated or pacified by certain therapies, herbs, and food. So the goal of the therapy is to counter excess or deficiency first, and then you can have your specific herbal therapy. They also include aromatherapy, massage, meditation, and yoga. The good part is that today there are national standards and certification requirements for licensure to prescribe herbal therapy for practitioners of traditional Chinese medicine and the naturopathic doctors. There's an exception to these medical practices. However, herbal use and distribution are open to individual interpretation that can range from being misinformed to a limited self-study. There are, however, good certification programs in herbal medicine available for clinicians and guidelines for the safe herbal practice that has been established by the American Herbalist Guild, which is the AHG. It's a nonprofit organization that represents the goals and voices of herbalists. It is the only peer-reviewed organization in the U.S. for professionals specializing in the medicinal use of plants. They've developed their own code of ethics. They do continuing education, and they set the standards for professional members. When it comes to herbal medication safety, we have to be cautious. In the U.S., pharmaceuticals must follow strict regulations set by the FDA that make them maintain consistent standards of quality, and they have to have strict guidelines in research and development and processing. The FDA regards herbs as foods, and so they do not fall under the FDA's drug and pharmaceutical standards. So many of the herbal manufacturers in the U.S. have adopted the FDA's good manufacturing practices criteria, which is good. And this helps them establish federal guidelines for plant management, disease control, harvesting, storage, and distribution of the food and herbs. When they talk about evidence grading, there are several systems that have been developed to provide clinicians with evidence-based methods to understand. Right? They talk about some of the different resources we have, like the Natural Standard Health Notes, Rakel's Evidence versus Harm Scale, the Cochrane Database of Systematic Reviews, which we use a lot. There's a lot of different ways that we have for the matrix for grading the evidence, but it can be very challenging. There's a couple of different tables in your book that help kind of put in an easy format for us to see that. Like acupuncture is a grade C, diet and exercise a grade B, and then they put the Rakel risk score on there as well. So we do have some resources in practice. The book mentions there are 3 factors that become problematic when evaluating the CAM therapies, and that includes that the Western scientific method is designed to measure single chemical components, but the complementary and alternative medicine looks at the whole plant. The definitions and concepts that we use in CAM, like yin yang, those kind of things, pose a unique problem for evidence-based methodology researchers. And then the outcomes in these traditional medicines are determined largely by empirical rather than experimental or diagnostic measures. Sorry, I didn't flip through all these as what I was doing. So yep, we covered these. I spoke of these already. Grim, you can read through all of these. Here's that example of the CAM therapy. That tells us the natural standard, health notes, Raycole. Okay. All right. Different herbal preparations. We have to remember that the preparation matters because in some preparations the potency of the herb is strengthened, and then in others it's actually nullified. So the details really do matter. Look at all these different types of herbal preparations. Extract, tinctures, infusions, decoctions, teas, ointments, compresses. These are the different treatments. So let's start with food and spices. The premise of herbal therapy is that food is the first medicine and spice is the second. You can have an impact on your health if you use spices on a regular basis. Unlike drug therapy, this form of herbal therapy has a gradual effect and minimal, if any, long-term side effects. Aloe has been around forever. It can be given as a laxative or a gel for abrasions for minor burns. Cilantro is a common herb whose fresh form is leaves and stalks, and then you can also have the seeds either whole or ground. And the seeds are called coriander. When it's fresh, the herb is commonly referred to as Chinese or Mexican parsley. It is high in vitamin A and has high levels of vitamin K, folic acid, niacin, beta-carotene, vitamin C, and vitamin B6, iron, and manganese. It's typically been used as a digestive aid or an antispasmodic. Some people have used cilantro oil to affect rheumatism or joint pain. Cilantro's phytonutrients and fiber can help maintain a good high-density lipoprotein. They did study coriander, like the seed or the ground seed, was found to reduce liver function tests and improve the adverse effects of thiazosinamide-induced hepatotoxicity in rats. It is considered to be safe. High doses should be avoided in pregnant women. Cinnamon, one of the oldest, most commonly used spices in the world. We use it in baking and cooking all the time, right? But it's also popular for potential health benefits. It's been used for treatment of diabetes, GI complaints, and inflammatory issues. It's supposed to help boost cognitive function, and part of it has even been found to have an antimicrobial function as well. There are a lot of different species of cinnamon, so you would really have to know what you're doing. I find it interesting that in the book it talks about they did one double-blind randomized controlled trial, placebo trial of cinnamon supplementation in 150 newly diagnosed patients with type 2 diabetes, and it appeared to be effective in controlling hyperglycemia without any untoward effect. But, of course, we know cinnamon is not considered a primary therapy. But it's something maybe we could offer to our patients with diabetes. Fenugreek is not one that I am familiar with. I've not seen this one a lot, that people come to me and say that they're on it, but apparently it's a very popular one. It can be an herbal supplement or a condiment to flavor of foods, and it can be eaten. It has been used to treat constipation and also with glucose control. Ginger. We've known for a long time ginger is very good with nausea. It's a safe one to give pregnant ladies for nausea. It's good, like they have ginger chews or ginger little lozenges type of thing to suck on that can really help with nausea for people. It's been well studied. Then we have thyme. It can be used to relieve your cough because they think it relaxes your tracheal muscles. It's been studied in a couple of different things to use as a treatment for bronchitis. One of the studies studied thyme and primrose root and concluded that the combination of thyme fluid extract and primrose root tincture was well tolerated and did result in clinically relevant decrease of bronchitis symptoms and shortening the duration of acute bronchitis compared with placebo. Another study looked at it. And the oral treatment of acute bronchitis with thyme-primrose combination for about 11 days was superior to placebo in terms of efficacy, and it was well tolerated. So that could be something, thyme and primrose, that could be very attractive for patients that are trying to avoid traditional Western medicines that we give. You know, maybe they don't want steroids and acyclovir or something along those lines. Who knows? All right, so then they go into some of the specific disorders like GI disorders and what are some of your options that people often use. So caraway can support the digestive process. Triphala can encourage the digestive flora. Caraway, psyllium, and senna, we know, stimulate elimination. We use psyllium and senna all the time. They've been compounded into two medicines that we use. And then diarrhea for carob powder and psyllium. I do want to point out that psyllium can be really good also for regulating blood sugar levels in diabetes because it's a soluble fiber and it's a bulk forming agent that will soak up the water in the colon, so it helps to create firmer stools. Psyllium has shown favorable effects on a number of conditions, including weight reduction and satiety, which also I think leads to the cholesterol and triglyceride reduction, a decrease in your fasting glucose, or reductions in your blood pressure. So psyllium can be a very effective choice, especially in things like metabolic syndrome. All right, when it comes to immune-boosting herbs, the human response is dependent upon a number of factors, right? So the type and intensity of the pathogen that's attacking the body, the degree of resilience and health of the patient at the time of exposure, how many organs are involved, and the stress perceived by the patient are all going to affect how you respond, right? They do talk about in your book that immune-boosting herbs and or drugs can play a significant role in preventing an escalation of the infection and are often critical in preventing a collapse of your body's immune response. Echinacea. This has been a hot topic for a long time, and it does show that it could be helpful for the common cold and infections. We have not been able to find it in the research yet, but traditionally echinacea has been used for hundreds of years, and a lot of anecdotal evidence to suggest that it could be beneficial for colds to decrease the length of symptoms. But it could also provide protection against infection So they looked at it at people taking echinacea during a 4-month period, reduced the total number of colds and decreased the length of the illness, and reduced the need for pain management compared with placebo. But then another study showed no benefit. So it hasn't been able to be replicated over and over again. But I do think that it is something you're going to see patients taking in practice and probably fairly safe and well tolerated. Ginseng is considered an antioxidant. You can help that way. It was found in some studies to increase plasma insulin levels and increase insulin receptors and sensitivity. So that's a good thing. It seems to have minimal and mild adverse reactions, though it does list a few of them as chest pain, diarrhea, impotence, nervousness, agitation. So the German Commission E considers ginseng to be an effective. So then we go to mycology, which is the use of mushrooms. So just like it says here, it could boost immunity, improve your energy and stamina. And then we have this group of fungi called cordyceps. They are endoparasitoids that live mainly on insects, and it's a fungal spore that lives on certain caterpillars. It has been used traditionally to boost immunity and improve your energy and your stamina. It can work on facilitating mitochondrial function. It's often combined with lion's mane to improve metabolism and adrenal fatigue. We have lion's mane, maitake, reishi, and shiitake mushrooms. What can men take for men's health? So herbs that may improve your stamina, libido, sexual function, and fertility. These are listed here. From a Western perspective, aging is synonymous with a natural reduction in testosterone. So if you have testosterone replacement, it can improve libido and your sexual function, but its benefit versus risk in older men is something we have to take into consideration. So when we use traditional medicine testosterone replacement in older hypogonadal men, it is associated with an increased risk of cardiovascular events. So, it is somewhat of a concern. So many men will seek herbal remedies because they feel they'll get better effects without the same perceived risk. Ashwagandha is classified as an adaptogen, which in herbal therapy is defined as an herb with no side effect profile that treats excess and deficient conditions and is safe when taken for a long time. It is used to strengthen the immune system, enhance your stamina, and improve libido. It is frequently referred to as Indian ginseng or winter cherry for its rejuvenating properties. It can be used as men and women as an aphrodisiac, but it's typically considered a male tonic. And we have gakshura. You can read about the horny goatweed. We can read about maca, and then we get down to saw palmetto. I want to bring this one up because this is one that's been around for a long time and you will see used in practice. It's a fruit of a plant known to decrease the symptoms of an enlarged prostate due to BPH. It is relatively safe and well tolerated by most people, but there are side effects possible: dizziness, headaches, nausea, vomiting, constipation, diarrhea, and the potential for slow clotting response. So if you are giving someone an anticoagulant or an antiplatelet, it is recommended that they do not take saw palmetto. And I do want to highlight this because this is something that's a potential down the road board certification type question to remember, that you cannot be on saw palmetto if you're taking anticoagulants. And I have had periods of time in practice where men are very resistant to stopping their saw palmetto because it was a medicine that was really helping their BPH and their urinary difficulties. All right, when we get into women's health, this is important as well because women are the largest consumers of healthcare. So when you look at CAM, you are complementary and alternative medicine, women tend to be the biggest consumers of this as well. So we talk about cranberry. Cranberry fruits and leaves have been used for a variety of problems. The one that sticks out the most in traditional medicine today is its use in urinary disorders. Research has shown that cranberry may play a role in prevention of UTIs, but it has not been shown as effective treatment for existing UTIs. And this is really important. It does not do you a lick of good to say, oh my gosh, I think I have a UTI. I have burning, I have all the symptoms. I'm going to go drink gallons of cranberry juice. There is no evidence, and it's been pretty well proven that it does not treat a UTI. However, the research will tell you that it does contain significant amounts of salicylic acid. And so if you drink it regularly, you can potentially increase the amount of salicylic acid in your body, which could possibly help reduce you getting UTIs. But if you drink it excessively, a lot of people have gastric side effects. So you have to make sure you're really, really using a lot of water with it as well. For many years, historically, centuries, we've used it also as a treatment for wounds. Dong Quai, I'm sorry if I'm butchering some of these words, has been used for centuries with menstrual pain or PMS. A lot of the female complaints have been treated with this as well. Again, same thing, we have to be careful that watch out for if you're taking anticoagulants. I'll let you guys read up on that. Dong Quai. The next one is the raspberry leaf, and this has been long used as treatment for morning sickness in pregnant women or as a uterine relaxant. Usually it's given in a tea, can be consumed by women during pregnancy. It has been found to shorten labor without identified side effects. It's also suggested that the raspberry leaf might decrease the likelihood of preterm and postterm gestation, artificial rupture of the membranes, or the need for a C-section. And it can help with menstrual cramps and reduce severity of bleeding. But I don't think that in the OBGYN world I've seen a whole lot of this recommended to be used, but that is not my area of specialty, so I can't tell you that for certain. The next one is the shatavari. It belongs to the asparagus family. There you go. It means she who possesses 100 husbands, which is a good way to remember it because it's used for fertility and vitality. It is thought to be estrogenic, so it could be possibly helpful for balancing the hormones in women. And for men, it could possibly help improve libido. Interestingly, the asparagus you can buy in the store has almost the same properties as shatavari. Next, we go on to mental health. I did want to point out that the book slides here leave out DHEA, and I wanted to talk about that. It is in your book. So DHEA is a steroid precursor. It's found in plants from the yam family, and we know it's secreted by primate adrenal glands. Physiologically, dehydroepiandrosterone, DHEA, is converted into androgens and estrogens, depending on your gender. And it could raise the blood level of the precursor of human growth hormone. We do have evidence to support the benefit of DHEA replacement in patients with adrenal insufficiency. But there's no established indication or accepted pharmacological preparation. So because there's few studies on humans, the exact pharmacokinetics and pharmacodynamics are not known. It does appear to be readily absorbed through the GI tract. But because DHEA is a hormone-like drug, it can cause negative feedback to the adrenal glands, which could reduce production of your endogenous hormones. So adverse reactions to be expected with medicines that are an androsteroid include aggressiveness, hirsutism, insomnia, and irritability. Patients with hormone-sensitive cancer should not take the DHEA. You should not take it if you're pregnant or breastfeeding. And if it's used for depression, there may be a 4-week lag time. I did want to talk about that on here. Otherwise, it talks about ginkgo. It can help increase cognitive blood flow and cognitive ability. It comes in many forms. You can find it in tablets, capsules, sublingual sprays, juices, and foods. It is thought to stimulate prostaglandin synthesis and thereby causes vasodilation, increasing tissue perfusion and cerebral blood flow. It's been used for centuries to improve mental alertness. Today, it is used in the treatment of CVA and peripheral vascular disease. And it can be taken to improve cognitive abilities, concentration, and memory. Doses for confusion or dementia can be 120 to 240 milligrams daily in 2 or 3 divided doses. For vascular disease, there's different dosing as well. It can have adverse effects of diarrhea, headache, nausea, vomiting, bruising, bleeding, and seizures. Using ginkgo leaves to make a home remedy is potentially dangerous because ginkgolic acid and the difficulty in determining the quantity of the active ingredient. It cannot or should not be taken with anticoagulants or antiplatelet medication. It has been, the German Commission E approved ginkgo for the treatment of dementia and peripheral arterial disease. Kava, also called ava, awa, kava, kava, comes from the dried root of a member of the black pepper family, and it has been used to treat anxiety, fatigue, or insomnia. It is native to Pacific Islands, so it has been used by Hawaiians as a celebratory drink, similar to how alcohol is used in other cultures. But, unlike alcohol, kava does not stimulate aggression, and it's not associated with hangovers. So that's a good thing, right? In therapeutic trials, kava seems to act on the GABA receptor, similar to a benzo. Like benzos, kava has been used in the treatment of seizures and has been used for sedation. It seems to work best in divided doses 3 times a day. Unlike a benzo, it does not seem to produce dependence, but we don't have a ton of studies. When used short-term, it seems to have few adverse effects. Long-term use may decrease your platelets, cause dry, flaky skin, reddened eyes, shortness of breath, pulmonary hypertension, or cause weight loss. Because it acts like a benzo, it may potentiate alcohol or other sedatives. So like phenobarbital, benzodiazepines, bad. And at higher doses, kava seems to block dopamine receptors, therefore it may improve psychotic levels of anxiety and interact with antipsychotic drugs. So it should not be used in pregnancy or when breastfeeding for sure. The one thing that your book does not talk about, which I think it ought to, is to tell us that numerous reports of severe hepatotoxicity and liver failure have been described with kava. It can be as soon as just using it for a few weeks. The U.S. Food and Drug Administration advised that kava should be used with caution in patients with pre-existing liver disease or at risk for liver disease. Hepatotoxicity is a possibility with prolonged use. So it is somewhat of a more dangerous drug, and I definitely would tell people not to mix kava with benzos or alcohol because it works on GABA as well. Then we talk about melatonin. It's not an herb, but a hormone produced by the pineal gland. Because it is a hormone, exogenous consumption over extended periods of time could actually act as a negative feedback and then suppress our normally secreted melatonin. There is a lot of mixed feelings on melatonin, of good and bad. It's one of those things where you'll find providers that live and breathe by it, and you'll find others that will tell you it's an absolute joke. One of the things about melatonin is that the timing of when you take melatonin is really important. And I did listen to a wonderful lecture not that long ago by a psychiatrist who specializes in sleep, and he really talked about the importance of taking melatonin, if you're going to take it at all, is the timing. And he said, you should really take it around dinner time so that it's working well by the time bedtime is ready. It does talk about in your book that melatonin is decreased by the patient's exposure to light, so we should consider advising patients to reduce exposure to artificial light or to synchronize their activities with the sun to stimulate their endogenous melatonin. It is released during the fourth stage of sleep, along with prolactin and growth hormone. It is used to induce sleep via the same GABA mechanism as benzos, and is widely used to prevent or treat jet lag. They do say that long-term use can reset the sleep-wake cycle and contribute to disturbed sleep cycling. In the book, it actually says it should not be taken more than 3 nights a week. And it does talk a little bit about the timing. In older adults, the dosage is usually 1 to 2 milligrams taken 2 hours before bedtime. In the hospital, when we prescribe it for elderly people all the time for sleep, we give it at 9 o'clock and then turn out their lights and expect them to go to bed. So that's what this gentleman was saying, that we'd be better off giving it with our dinner than waiting to take it at bedtime. Also, to remember, melatonin potentiates benzos, and it can potentiate succinylcholine. Interestingly, too, in your book, it talks about the adverse reaction. Also could include hypothermia and tachycardia. That's interesting to me. We don't really talk about that when we give it to people in the hospital a whole lot either. Then your book talks a little bit about valerian root. It was actually first described by Hippocrates as a sedative and an anxiolytic. Its mechanism of action isn't well known, but it appears to have a relationship with valerian root affinity for the GABA receptor. It was not found to reduce anxiety when it was compared to placebo in a single small trial. There's not a lot of side effects with it. The one way that I do think it's most useful is what it talks about here with valerian tea at bedtime to help people fall asleep. It should not be taken with alcohol or other CNS depressants, which is a really important point to tell people. Then when we get to the SAMe and the St. John's wort, the SAMe is involved in the synthesis of various neurotransmitters and may have a faster onset of action than conventional antidepressants. Overall, it is superior to placebo and is well tolerated with few side effects, but there have been some cases of mania reported in patients with, so maybe not great to use for bipolar depression. And then St. John's wort have been shown that for mild to moderate depression, it was comparable to an antidepressant. So it was effective for some people and could be very helpful. The active ingredients are hypericin and hyperforin, which act on chemical messengers in the nervous system that regulate mood, and they can be deactivated by light. So this is why many of the products are contained in amber packages. It can be used pretty safely for short term, but extended use can actually lead to vivid dreams, trouble sleeping, restlessness, anxiety, irritability, dizziness, rash, tingling, diarrhea, stomach upset. It's probably not something you want to take prolonged for the rest of your life. It does interact with SSRIs. So you cannot take St. John's wort and an SSRI together. If you're ever going to be prepared for a board certification question on St. John's wort, it is that you cannot take it with SSRIs. And it can weaken other medication effects, including birth control, warfarin, oxycodone, and digoxin, and some HIV medicines. So essentially, if someone's going to choose to use St. John's wort for a small amount of time, they should probably not be on many other medications. If you're ever in a pest situation and you have St. John's wort thrown in there, it may be a distractor, but it's probably cueing you in on something, because it's really important that we know that it cannot be used with some of those other medications. All right, other herbal remedies for pain. Chondroitin and glucosamine have been around forever, and we use them because it seems to stimulate chondrocyte metabolism and synthesis of collagen, which can improve the formation of cartilage, and is often combined with glucosamine for the treatment of pain. However, it can cause some dyspepsia, headache, restlessness, euphoria, nausea, or risk of internal bleeding. The chondroitin may potentiate anticoagulants, so you should not use them long term, but they can be used well for a short amount of time, and we probably ought to have caution with them if they're on an anticoagulant. It has been shown to be effective for some people for the treatment of their joint pain from osteoarthritis. All right, feverfew. You will sometimes see this in practice. It has been around for a really long time to treat headache or migraines, but also things like tooth pain, joint pain, stomach pain, menstrual pain. And for many centuries, it was used for women to take if there was a threatened miscarriage. Feverfew is also called bachelor's button, feather foil, Santa Maria, or midsummer daisy. It's extracted from the leaf of the feverfew plant. The assumed mechanism of action is the inhibition of serotonin release from platelets. It does have the potential for some adverse reactions and a withdrawal syndrome characterized by moderate to severe pain and joint muscle stiffness. Then we get into turmeric. This is the active, turmeric has the active component called curcumin, which has been extensively researched, and it's been shown to show basically decrease in inflammation is what they think, so it can help with arthritis, proctitis, Crohn's, ulcerative colitis, peptic ulcer, gastric ulcer, lupus nephritis, or chronic pain. There have been some promising studies done with turmeric in pro-inflammatory disease states. After 4 weeks of treatment in one study, they showed that the ulcers were absent. So they've studied this as used for at least with gastric ulcers. And turmeric can be helpful like an anti-inflammatory, and it is tolerated better in terms of side effects, and it doesn't have the GI side effects like NSAIDs could have. So there is a lot of use in turmeric. There is a lot of use of turmeric, and I think it's fairly well studied as one that I would not probably have a problem with my patients taking turmeric supplementation. Then we get to white willow bark, which is also considered an anti-inflammatory and antipyretic. It's similar to salicylates in a lot of ways. Adverse effects appear to be minimal, but could be gastritis or an allergic response. It can work for some people as an analgesic, so not too bad to try if people want to try the white willow bark. Then we go to wintergreen oil. They are traditionally thought to be effective in relieving pain from muscle strains or inflamed muscles, ligaments, and joints. Interestingly, they think it acts by counter-irritation, which masks pain, or through the analgesic and anti-inflammatory effects of the salicylate. So 10% wintergreen oil is applied to the skin, no more than 3 to 4 times a day. And it's really important to remember that overuse can result in salicylate poisoning. So if you're allergic to aspirin or taking an anticoagulant, you should not use wintergreen oil. All right, entheogens are substrates that are derived from plant or fungi that produce alterations in perception, mood, consciousness, cognition, and behavior. Historically, these have been used for a number of cultural traditions, including the religious or shamanic, spiritual, and medical practices. So there's several species here we talked about, or that the book talks about. Cacti containing the stimulant, mushrooms containing psilocybin, which is a Schedule I hallucinogen narcotic, plants containing ibogaine, plants that contain DMT extracts with natural compounds, and plants that contain cannabinoids. The psilocybin are essentially magic mushrooms, right? So it produces visual and auditory hallucinations and a change in consciousness. These are the things that I think of when you talk about like Native American history, and they would be smoking things in their hut to have their visions type of thing. There is a lot of study right now in the use of psychedelics in like hospice and pain and some different things. So psilocybin is kind of coming around in studies. You're going to hear about it quite a bit, potentially as use in kind of the alternative view of how to treat pain or suffering or like PTSD type of thing. The book talks about that the psilocybin has been studied about and looked at. The clinical focus is on the influence of the 5-HT receptors found in psilocybin and their influence on areas of the brain. So there is a lot of research happening in that area. So what do we need to know as advanced practice providers and who are going to be prescriptive providers that prescribe things? We obviously know that we want to use evidence-based practice, but we would always respect the patient's right to choose and acknowledge that consumers are using these herbs at an ever-growing rate. So we have to be prepared to educate patients and how to incorporate them into our practices as well. Just because the product is natural does not mean that it's risk-free. Box 8.2 I want to highlight here because these are herbal resources. East-West School of Herbology, the Herb Farm, Spring Wind Herb Company, Banyan Botanical, Mountain Rose Herbs, the Tao of Tea are good resources and references that you could refer your patients to. You have to understand the risks. Consult reliable resources, refer to trained CAM providers, and remember to keep an open mind. So, stay current on the scientific evidence, have open communication to foster education about safety and efficacy, and what I would add on here as a summary is to remember to ask about them, and make sure you do it in a way that fosters them actually wanting to answer your question because you're being non-judgmental. All right, knowledge check. Which of the following herbal therapies may assist patients with insomnia? Ginkgo, kava, saw palmetto, or senna? If you guessed kava, you are correct. Remember, kava, however you say it, is used to treat insomnia or anxiety, but it can cause the sedation, so we don't want to use it with alcohol or other sedatives. Which of the following is a reliable source for evaluating the scientific evidence for the therapeutic benefits of herbal therapy? If you picked C, the natural standard is a complementary medicine grading system designed to provide clinicians with the latest scientific data and expert opinions. All right, that was Chapter 8. We will see you in Chapter 9.